All right. So periodically, we've been checking in with the UK to see how things are going in Great Britain as potentially a bit of a forecasting tool for what happens in the US. And I think across the last year and a half, the UK has been somewhat of a good indicator of what's coming our way and remains an interesting point of reference, especially looking at some of the differences in vaccination, et cetera. But before we get to kind of the preview of what's happening in the UK right now, I thought this article that just came out a couple of days ago in MMWR was a good thing to update us all on because it is the latest data we have on vaccine effectiveness from the US. So this was published out of the CDC Vision Network that we've periodically seen large vaccine effectiveness studies come out of during the course of the pandemic. It's probably the most robust network we have in the US to look at vaccine effectiveness. You can see it's across 10 different states. And what they did in this analysis is looked at cases between this past December and last month, looking at incidents of BA1 Omicron infection and BA2 variants, including BA2.12.1, which was obviously the most dominant during the late spring and into June, and looked at what the vaccine effectiveness rates were for people who had gotten 2, 3, and 4 doses of the vaccine. So letting us know how our boosters are working against the latest variants and compared to Omicron. So you can see that there were 2 basic analyses they did. One was looking at visits to the emergency department or urgent care. Those are the data that are included here. And you can see it's a pretty robust data set, right? Over 100,000 people with a reference point of people who are unvaccinated, right? So over 50,000 unvaccinated folks who came into emergency departments or urgent care. And I think the first thing to look at is what the vaccine effectiveness was for Omicron. So good and bad news, I think. Obviously, vaccine effectiveness is quite a bit lower than it had been a year ago when the vaccines were relatively new. People were recently vaccinated, and the predominant strain of the virus was much closer to the original. But what you see is we still have relatively good protection against being sick enough to report to the emergency department or urgent care. And what we can see is that with 3 doses, that effectiveness goes up quite a bit and seems to retain its efficacy even after 120 days or 4 months after vaccination. So you can see there in that circled area for all ages, it's about 73% vaccine effectiveness for people who've had 3 doses of the vaccine, even if it's more than 4 months out. Now, again, much less than it was previously, but still pretty good levels of protection. Interesting that when you look at differences in age groups, the vaccine effectiveness for older folks seems to be higher. And with these studies, there's always a few caveats and grains of salt you need to take, including the fact that it's not a lot of people under the age of 50 who've received a 3rd dose, and there's probably a significant reason why that would be the case, and these folks might be at more risk, et cetera. But I think the more important thing, rather than focusing on specific numbers, is looking at the general trends. And again, the general trend is vaccine effectiveness is still pretty good against Omicron BA1 for protecting against ER visit and urgent care visit. That effectiveness wanes considerably after 4 to 5 months if you've received 2 doses. Seems to wane a bit after a 3rd dose, but maybe retained a bit more. The problem is, and there's the vaccine effectiveness after 3 doses. The problem is there seems to be a bigger drop off now when we get to more recent variants of BA2, BA2.12, and obviously now we're looking at BA5, and we don't have data there. But again, as we're drifting farther and farther away from the original virus for which the vaccine was developed, we can see our vaccine effectiveness starts to wane, and even more so when you look at people who received vaccine more than 4 to 5 months previously. And so you can see, even if you received a 3rd dose, if that 3rd dose was more than 4 months ago, your vaccine effectiveness is quite a bit lower against BA2 versions compared to what it was against BA1. And that's Obviously, there 26% vaccine effectiveness for folks who got a third dose and are more than 4 months remote. Now, when you look at breakdown between age groups, you see again, there seems to be much lower vaccine effectiveness for those younger populations. But again, the numbers are smaller, and there may be reasons why those folks would have gotten um, additional third doses. But I would just say the trends are probably the most important piece, and it shows if you've been 3, 4, 5 months out from your last dose of vaccine, your vaccine effectiveness is much, much lower. But the last thing, again, and a little bit of encouraging news, is with a fourth dose, that vaccine effectiveness seems to be boosted back up. Now, we don't have a long period of time for which to follow these folks in the fourth dose category. And so it's unclear how rapidly that effectiveness would wane. But again, it does seem that with the fourth dose, you kind of restore that effectiveness back to what was the best effectiveness, even with recent second or third dose, or maybe even more. So when we look at hospitalization data, the trends again are similar. You can see that a little better vaccine effectiveness compared to urgent care or ER visits, and that's expected. And with a third dose, even if you're more than 4 months out, pretty good effectiveness against hospitalization. And again, with a fourth dose, that effectiveness seems to be even higher. So the basic trends, I think, are what we've been talking about and what we've come to expect. Your protection from the vaccine depends quite a bit on how recent your last vaccine dose was, and therefore the importance of staying up to date on vaccine. And it's also important that with newer variants, effectiveness seems to go down. Sorry, and so again, seeing still good protective effect against hospitalization if you're up to date. So now we'll go to the UK and talk about kind of how the UK and the US have been a little bit related, or at least how the UK has predicted what will happen in the US. So this is going back to the beginning of the pandemic, looking at case counts normalized for population. So it allows us to look on the same scale and proportion. And so you can see the red arrow is the UK and that red curve, and then kind of the the faded ghost curve and gray arrow is the US. And so those two arrows represent uh, what was the original large wave of late 2020, early 2021, which was at the time the highest peak. And you can see the UK preceded us by many, many weeks, about 6 weeks or a little more in that wave. The next wave that came along was the Alpha variant. And again, that started early in the UK in December and January of 2021. But didn't really hit a peak in the US until in the spring of 2021. So again, the UK preceded us. For Delta, the same thing. The UK preceded us by about a month in their initial spike of Delta cases compared to when we did. And then for Omicron BA1, you can see the UK preceded us a little with a little less time lag, only a few weeks. But again, what happened in the UK eventually came to the US. Oops, sorry. And then back to now the BA2 curve. And you can see the UK had a relatively early peak in BA2 in the middle of the spring. We really didn't start to see a surge and peak in BA2 until May. And now the UK is into their BA5 surge, and we're still trying to see when that will peak in the US. So just a little taste of how the UK tends to lead us, and at least gives us an idea of what is coming our way. I think the same is true in terms of deaths. And that has been a bit of a shift in that relationship since you can see late 2020, early 2021, where we had much lower deaths proportionally compared to the UK. And that's because our vaccine rates were higher at that time, especially in the elderly and most vulnerable. But as vaccine rollout continued into mid to late 2021, the UK passed us and kept going in terms of getting not only second doses, but third doses, and now even fourth doses into the most vulnerable. And so that red arrow points to the UK's Omicron death count, and you can see they had essentially half the per capita death rate that we did for Omicron cases, even though they had more recorded Omicron cases. For their BA2 wave, they had a peak of similar magnitude compared to BA1. That hasn't hit the US, and it's unclear whether we're just lagging again. It's a month or so that um, recorded deaths lag behind cases and hospitalizations, at least often 6 weeks behind cases. So we're still kind of slowly increasing in the US, but it's unclear whether we're going to hit that or not. And then you can see just recently over the last week or so, the UK has started to jump up again, and that's a reflection of BA5 cases. So I think it points to the fact that we can expect an increasing number of deaths in the US as this current BA5 wave continues, and we keep catching up from the BA2 wave that we really just experienced. And those two confluent things are probably going to give us some more deaths. Now, as I pointed out, the UK has a much better rate of vaccine across most parts of the population except younger kids. Uh, we still have pretty poor young kid data, to be honest, so that's not a huge difference, but they really are far out in front of us in terms of the number of doses of boosters that have been given to the more vulnerable folks in the population, as you can see here. So here's some recent insights from the UK, I think, that give us a little more visibility into what's going on there. So the UK has a couple of data collection and situational awareness tools that I think are really good. One is this Office of National Statistics surveys that they do, looking across a large swath of the country, finding out from people whether they got tested, whether their test was positive, et cetera, et cetera. And so you can see that over the week, last week, I believe these data were valid for over 5% of the population of the UK tested positive. That's pretty incredible when you think about it, that 5% of the population, had symptoms or had a reason to go test, went and got tested and then tested positive. And you can see that that percentage is approaching what they had seen with previous BA1 and BA2 waves. So they're really looking at very high rates of infection across communities in the UK. And that probably is much higher than what's reflected in those official counts that we saw there. Again, this is targeted surveying that asks a wide representative population, not necessarily just the aggregate data that you get from the official counts. The second point I think to bring up is rates of hospitalization across the population for the UK appear to be essentially now as high as they were for BA1 and BA2. You can see again, looking back to that wave last year, not approaching yet the rates of hospitalization they saw at their previous peak. But again, now the UK has much higher rates of vaccination boosters compared to what we do. And so their experience between those two was inverted. They had much higher hospitalizations and deaths back, in the very beginning of 2021, much lower in the last 6 months. We actually had more with Omicron than we had with the previous wave. And then you can see ICU hospitalizations are up a bit. Deaths are relatively flat, but trending up a bit. And what's also interesting and amazing, really, when you think about it, is essentially everybody in the UK has antibodies against COVID-19. So that means they're either vaccinated or infected. I think these are all antibodies, including spike. So I think it reflects vaccine as well. But essentially, again, that idea that once we get, a wall of immunity and everybody's either vaccinated or infected, then we're all protected and things will go away. Again, I think we can hopefully now put that notion to rest. The other thing to note here is that during that week, 1 in 33 of people who were surveyed reported long COVID symptoms. That's all comers, at any given point in time. That's, not insignificant by any means. I think the other piece of this survey that was really interesting is when you looked at the differences of long COVID in people who'd been triple vaccinated and infected with different variants, that long COVID prevalence didn't seem to change from Delta to Omicron to BA2. I think there's been, again, this assumption, and certainly there's been stories in the lay press that newer variants have lower rates of long COVID compared to Delta and previous. But again, the data don't necessarily bear that out. I think the one also interesting point there is if you look at those who were only double vaccinated, folks with Delta did have a higher rate of long COVID, approaching 10% compared to BA1. Now, again, unclear whether time and other things had a factor in here. And also interesting to note that these rates of 4 to 5% for people who are triple vaccinated are quite a bit lower than what most studies are showing in overall populations. But again, most people who are getting long COVID are not triple vaccinated. Many are unvaccinated, to be honest, and some have only had 1 or 2 doses. And so I think, again, trends being more important than the specific numbers, the takeaway here is that, again, more evidence that appear to indicate that vaccination and boosting reduces your odds of getting long COVID, but that when you compare apples to apples, your risk of long COVID may not differ very much between different variants. This is just as a quick aside, a very stark contrast to, again, what many other studies are showing in terms of the overall prevalence of long COVID. And again, long COVID across all different age groups. And this was a recent article that came out that looked at a meta-analysis of multiple studies of long COVID in kids. And you can see here the overall takeaway is that all of these studies put together pegged long COVID symptoms in kids at about 25% of kids who had a previous COVID infection. And again, this isn't just kids who ended up in the hospital with COVID or had severe COVID infection. These are kids with mild COVID infection as well. And so, again, very high rates of COVID across the population, probably much higher in populations that have lower vaccination rates, like kids. And so another argument for why staying up to date with vaccines is probably a really important thing. These are just some of the more common symptoms and conditions that were noted in kids with long COVID, but we can go on from there. So back to the UK survey, and again, just to highlight the number of people who were infected with COVID-19 during that week of survey. Again, 1 in 19 people across the entire country of the UK had COVID during that week-long period. That's pretty amazing. Now, when you look at that, breaking it down by age, not surprisingly, you see that the highest rates of COVID occurred in late adolescent and young adult populations. Now, again, this is not active surveillance across all of these populations, including asymptomatic people. These are people presenting for testing on their own. So they either have symptoms or they have another reason to go. And as we've discussed, across multiple studies and surveys, young people are much less likely to be tested. So kids and school-age children, much less likely to present for testing, even if they have symptoms. So there's some bias and skewing here. But again, highlights what we know is that it's the young people that drive transmission in the community. Again, if you look at people, over the age of 50 and especially over the age of 70, they have much lower rates of infection, even though they probably present for testing at a much higher rate than others. And so again, in the UK, what's happening now is young people are driving transmission across the community, but they're seeing increasing hospitalization rates across all of the community. The other thing to note when you look at hospitalizations, breaking it down by age, even though more elderly are getting hospitalized, proportionally, when you compare to previous epidemic waves, hospitalization rates among the elderly are actually lower than they were, but hospitalization rates in the young are much higher. So that red arrow points to the 100% line. So that's essentially the benchmark of where hospitalizations were in January of 2021, right? That was the previous large peak that we saw. And so you can see that since then, again, because since January of 21, the UK has vaccinated the most vulnerable and have kept them up to date with boosters to a large extent. In almost all of those populations, they never got back above, certainly everybody over the age of 45, they never got back above that 100% mark in terms of hospitalizations per population. Now, that's in stark contrast to kids, where not only have Omicron, BA1, BA2, and now BA5 been the highest rates of hospitalization they've seen in young kids and elementary school and age kids. They're seeing 3 times the hospitalization rate that they saw at that previous peak now. And in 5 to 14-year-olds, you can see it's already almost 200% of that previous peak. So again, pointing out that in a population that has very low vaccination rates in the UK, right, kids really under the age of 12, they've done a poor job and started very late in getting vaccines into that population. You can see that that's the one population in the UK that's seeing proportional hospitalization rates explode compared to what they've previously been. So again, vaccines make a big difference. The other area where I thought this was a really fascinating analysis, where vaccines are making a huge difference, is in the number of reinfections we are seeing. So if you look from the bottom up, these different colored curves are from different time points in the pandemic, so different epidemic waves. And across the x-axis on the bottom, those are age groups, right? So 0 to 4-year-old, 5 to 9-year-old, et cetera, all the way up to 90-plus-year-old. And so this shows you across different age demographics, what are the percent of cases that are reinfections occurring now? So if you look at October of 2021, right, ancient history now, right, that was still Delta infections. You can see that there were very few reinfections detected across the entire spectrum of the population. Now that started to change significantly when you got into BA1 Omicron, that's in January. And then in BA2 and now BA5, which is the July 2022 curve at the very top. And what you can see is in each of these sequential epidemic waves, the percentage of documented reinfections has gone up considerably, but it has gone up by far in kids, right? Again, the segment of the population that is least vaccinated. Interestingly, there is this notation here that second spike that you see in kind of people who are in middle age, between the age of kind of 35 and 50, those are the parents of kids, right? And so the implication there is that people who have small kids in the house probably have a higher rate of reinfection as well. But this rate of reinfection is approaching now 50% in a week and a half ago, looking at kids between the ages of 5 and 15, which is really where the peak is. And again, if you look at that compared to the rate of 2 and 3 doses, you can see that there's a pretty good inverse relationship. And those populations that have essentially received very little vaccine and no boosters, that's where you're seeing high rates of reinfection. Populations that have received boosters and are relatively up to date, you can see have very low rates of reinfection. Now, the implication for the US is obviously, as I mentioned, we have pretty low rates of boosting compared to what we've seen in the UK, and very remote last doses of vaccine, as I've talked about. So I think our risk of reinfection is going to look a lot more like those 5 to 9 and 10 to 14-year-old age groups as we go into the late summer and fall in the US. And so I think the implications are that a much larger BA5 and whatever the next variant is going to be, whether it's BA5.2.1 or BA2.75, those newest variants that seem to be rising, those reinfection rates are going to be much higher. And I think our hospitalization rates are going to be much higher, as the UK is reflecting. So again, the key to preventing all of this is to get as many people up to date with vaccine as possible. And then the second thing is to make interventions that reduce community transmission, again, focusing on schools and young people, which is where transmission comes from in the community. That's all I have. Thanks.